Hi, this is Dr. Ryan Bell with Yada Yada Health. I'm a pediatrician. I'd like to talk for a few minutes about my personal favorite skin condition, eczema. So, really common thing that we see in our practice. Most kids, especially the middle of the summer and middle of the winter, can get dried out and flare up with eczema. Common spots that you'll see it, so especially in babies, on their cheeks. Older kids tends to be on their trunk, also on their inner elbows and behind their knees. Those are classic spots to get dry patches that will flare up, sometimes be red, sometimes be bumpy, usually itchy, and something that's very treatable. So we're going to talk about just the basic approach to eczema. If you feel like that's what's going on with your child, try a couple of things first. Be sure to follow up with your medical provider if you feel like things aren't going well, because there are other rashes that can mimic eczema, but eczema is probably the most common thing we deal with from a skin standpoint in our pediatric practice. Eczema is caused by inflammation in the skin, brought on usually by different triggers. The most important one seems to be the dry air. So depending on what climate you live in, maybe it's not something you deal with as much. In a drier climate, it tends to be super common. The first thing that I'd have you try if you're worried about eczema, try just a good thick moisturizer. If you're able to get something like Vanicream, Eucerin, Vaseline, so just something thick and goopy that will stay on the skin. There's really two reasons for that. One is that it will help lock in moisture and also can help other medications that you might use to penetrate down deeper into the skin if it's hydrated well. So those good thick moisturizers, usually twice a day, is a good starting point. If that doesn't seem to get you where you need to be, the next thing I would try is an over-the-counter strength hydrocortisone cream. So 1% hydrocortisone. Do the hydrocortisone first and then put your good thick moisturizers on top of that. It's very safe to use anywhere on the body, even areas that have thinner skin like the face, the neck, in the groin area. Those are areas that you've got thinner skin where you have to worry more about using stronger steroids. But that 1% hydrocortisone is very safe to use anywhere, really for any length of time that you need it. The second step there after hydrocortisone would be to do a prescription strength steroid. So we can do a stronger hydrocortisone cream. We can do a mid-potency steroid if we need to. I like to use triamcinolone. Some people like Desinide. There's other options. But sometimes you need a stronger steroid that you can only use for short periods of time. So usually there'll be instructions with those to try to minimize their use, maybe to use them for a week or two at a time, or to alternate them where you use them for a few days and then stop, and then use them for a few days and stop. But those stronger steroids are safe to use other places on the body where the skin's thicker, like your extremities, your chest, your back, your rear end, your legs. You just don't want to use those stronger prescription steroids on the thinner skinned areas of your body, like your face, your neck, your groin area. So other things that sometimes are helpful with eczema, try a real mild laundry detergent. Sometimes that can flare up skin. You can also try doing bleach baths. So taking about half a cup of bleach, adding it to the bath water, has some disinfecting and cleansing and restoring effect on the skin. If you've got eczema, that would be something to try if the topical things aren't working. So that's a good starting point for eczema. Again, get in touch with your healthcare provider if you've got a rash that doesn't seem to be improving with that approach. If you think it's eczema, try your thick moisturizers, try an over-the-counter hydrocortisone, and then look at getting a prescription strength steroid cream. Look for triggers that you can eliminate. Maybe try a bleach bath. but those things are very effective for a very common pediatric skin problem.